Today's quick coding clinic review answers the question of how to code an out-of-hospital cardiac arrest when the patient has already been resuscitated prior to arriving at the hospital. This question was addressed in the coding clinic from the first quarter of 2024 on page 27. My name is Claire and I'm an inpatient coding auditor. In my coding clinic review videos, I provide explanations of topics covered in coding clinic. My goal is to help you improve your medical coding skills and code with confidence. If you find this helpful, please consider subscribing to my channel to receive notifications whenever I release new content. Frequently, a patient may suffer a cardiac arrest either at home or in another location, prompting the administration of CPR at the scene, leading to the patient being successfully resuscitated. Subsequently, the patient is transported to the hospital where they're admitted for further care even though they're no longer in active cardiac arrest upon arrival. Many coders have wondered how should this admission for cardiac arrest prior to the hospitalization be coded. Should a code from category I46 cardiac arrest be assigned? Or should code Z8674 personal history of sudden cardiac arrest be used since the cardiac arrest has been resolved? According to Coding Clinic, a code from category I46 cardiac arrest should be assigned rather than the history code since the patient is receiving continued care for the cardiac arrest. The cardiac arrest meets the definition of a reportable secondary diagnosis because it requires clinical evaluation, therapeutic treatment, and diagnostic procedures. This advice applies regardless of the location of the cardiac arrest or whether the patient was successfully resuscitated. When the underlying cause of the cardiac arrest is known, that should always be sequenced first, as instructed by the Code First instructional note found at code I462, cardiac arrest due to underlying cardiac condition, and code I468, cardiac arrest due to other underlying condition. The cardiac arrest is coded as a current condition rather than a personal history of cardiac arrest because the patient is currently undergoing treatment for the condition. According to the official coding guidelines, personal history codes are only used to explain a patient's past medical condition that no longer exists and is not receiving any treatment. Let's look at an example. In this scenario, a patient experienced a cardiac arrest at home and was successfully resuscitated by paramedics. Upon arrival to the emergency department, the patient was alert and orientated. In the emergency department, the patient was placed on a cardiac monitor and pulse oximetry. An EKG was performed and confirmed a complete heart block. The patient was subsequently admitted to undergo an emergency pacemaker placement in the cardiac cath lab. The patient is currently undergoing active treatment, including clinical evaluation, therapeutic interventions, and diagnostic procedures, so we will assign a code from I46 to capture the cardiac arrest. The underlying cause of the cardiac arrest was determined to be a complete heart block, which is a cardiac condition, so we will assign code I462 for cardiac arrest due to underlying cardiac condition. Following the instructional note, we will sequence the code for the heart block before I462. So that's it for today's quick coding clinic review. I really hope that this video was helpful for you. If it was, please give it a thumbs up, and if there's any topics that you would like me to cover in the future, just leave a comment below and I'll add them to my list. Thanks for watching, and until next time, happy coding!